Right now, there is a current trend in research and clinical practice where we're really interested in looking more at parent-mediated approaches to working with children with autism. And there are multiple reasons why we're interested in doing that. Research is starting to evidence that parent-mediated approaches really support parental efficacy, or kind of that parental self-esteem, the ability to look at yourself as a parent, to feel competent with your own child and connected to your own child. Another reason that parent-mediated approaches are starting to kind of come to the forefront is obviously there are the financial benefits for families. There's such a high cost involved with having a therapist in your home 20 hours a week or 40 hours a week, whatever it is. And parent-mediated approaches really allow for there to be more typical family time. Another reason is that the parent is always with the child. As a clinician, we may be able to come and work with your child a couple hours a week, but if you are armed with the ways of interacting with the child that are the most beneficial, it's like your child having access to a gym 24 hours a day, 7 days a week, versus having access to the gym maybe 30 minutes or an hour a week, twice a week. We really want the kids to have the practice and interacting in certain methods and certain ways that is going to allow them to practice it in all different types of settings, with siblings, with different members of the family, out in the community, and parents are always with the child. So it makes a lot of sense that the parent would be the one that was the most able to access the child across a multitude of settings. There are also some benefits to siblings. When you're working with a parent who's going to therefore be working with their child, you're actually going to be able to benefit siblings that are in the household as well, because the parent has the tools. A clinician coming into the home may only be working with that child that's diagnosed with autism. We know that siblings of children with autism actually have a 20 times larger chance of having autism or some kind of semblance of a shadow diagnosis. And so having a parent who's already armed with methods of interaction, ways of intervening, may help them not only be able to identify those aspects of autism maybe a little bit earlier in subsequent siblings, but to also be able to interact with their children in more developmentally appropriate, interactively rich ways.